Hello, good day, and to all our viewers, welcome again to another episode of Undefined. Very pleased to have my friend here, Khater, as our guest today. So to get us started, Khater, I will invite you to introduce yourself.
Hello to your viewers, and thank you very much for having me. My name is Khater, and I'm a second-year Master's of Health Science, specializing in epidemiology at like a university. And yeah, I'm glad to be here.
Thanks so much, Khater. So maybe we can start with that since you kind of identify yourself as a student. So could you tell us a little bit about your program at Lakehead University and probably what inspired you into this field?
Yeah, obviously, my program, I'm in second year, Master's of Health Science, specializing in epidemiology. And I think my interest in this field and work probably developed at an early age, I would say. And that's rooted back to Africa, back to Sudan, where I think there was a time that I kind of like volunteered and also worked in a refugee camp. So during that time, like the conditions there and like the shelter and like, the health situations kind of like significantly was there was a spread of infectious disease at the time, and obviously due to lack of like medical provision over like population, obviously, and also food and water, and and just kind of like seeing those people die from like curable diseases like malaria and tuberculosis, and especially like including some people that it's kind of like inspired me to you know, volunteer with like UNICEF and other like health organization around the area. And, and I think I remember my first involvement with like the idea of public health was actually hygiene and hygiene promotion program in the camp. And I think from there, that's kind of like that's experience being involved directly with those initiatives kind of like helped me to develop basic understanding of like the field of health and also like kind of like understanding of public health and influence of like complexities of like socioeconomic and also like the environmental and political factors. And yeah, those are the earlier I think experience that kind of like helped me develop interest in this field, as well as also kind of like give me the idea of public health. So I hope I answered the question.
Oh, definitely. Quite profound background there, beginning from Sudan, you said, and up to this point in Thunder Bay, Canada. And I'm sure you've lived in a few other places here in Canada, but I want to focus specifically on Thunder Bay. I know that Thunder Bay is in Ontario, but it's not a well-known place in Ontario. If it is well-known, then it's to the extent that, a lot of people don't necessarily want to stay here. I've heard a few people said that. But I wanted to ask you, how has it been living in Thunder Bay? What attracted you to Thunder Bay, and what can you say to prospective students, but generally people who are interested in moving to Thunder Bay?
Yeah, that's I hope I won't get in trouble by answering honestly in that. But no, as you earlier mentioned, I've always lived in metropolitan cities. Before I moved here, I lived in Ottawa, and moving here in Thunder Bay, it was a quite a change, I would say, moving from the busyness and of city to coming into like a small place like Thunder Bay. But also, I think it's a change, but I would say it's a good change because it's a beautiful place, first of all, like in nature and stuff, but also like there's things that in the city that it lacks here. So if you're into like, for example, variety of activities and stuff that you get used in bigger cities, it could be challenging. And also, for someone who's minority, it might be that's a bit challenge as well. Like, obviously, there's not a lot of diversity as, but now after a year being living here, I've realized that there's quite change in that.
Mm.
And what inspired me, I think, it's the program of Lake University, and also like where the university is located. I think, it's just, and then the focus of the program, and I think master of focus of the program, and also like toward the Northern Health. And I think um those are like things that probably draw me. And I would say, like, for prospective students, I think it would be a good change. Don't be hesitate to like try something new. I was obviously like trying something new. It could be challenging, but also it could be rewarding. You get to learn, see new places, but also like I think um good things as well. Like university, like a university, I think it has its pros and cons, I'd say.
Mm. Definitely, you seem to be quite at home here. How long have you been here so far?
Yeah.
A year. Wonderful. You talk a lot about, maybe not a lot, but maybe if you can say more about it, the diversity. You said it's not that much of a diverse environment. And since you've been here a year, do you feel that is changing?
Yeah, I think it's like, coming from bigger cities, like in bigger cities like Ottawa, or like it's quite often it's normal to like see that, diverse cultures and people. And coming into Thunder Bay was quite different. But over the year, I've realized that, obviously with the university being in the city, also that helps kind of there's, bringing to like new students. But also as a city at large, I would say also like I realized maybe there's a big change, and get to see like new restaurants that are opening. And so yeah, I would say it's starting to change a bit.
Okay. To be honest, I've witnessed these changes myself. I've been here. I think this is my third year, and I can say the people I've been seeing. I think I can begin to see the diversity improving since the 2 years that I've been here. And in terms of the restaurant, places opening up, new activities, and so on. So I'm definitely also a testament to that. I know that you are an academic, and it's something you enjoy. Since I've met you, I think you've been to a few conferences, and recently you've also had one of your papers published. Congratulations. The title I saw is Examining the Prevalence of Black Homelessness in Canada. Now that sounds a little bit strange. Strange in the sense that Canada has, become this fortress of of soccer, this safe space, for people moving, from war-torn environment, for people just, wanting to advance their social economic standard. And for the most part, people from, various African countries over the past few years have made Canada home. Now, to have a title of a paper saying examining the prevalence of Black homelessness in Canada, I think that may sound a little bit scary to people anticipating, coming into Canada to make it, home. And now we're talking about homelessness. How can this place, of so much promise, at least from the perspective of people moving here, at the same time, also harbor, people who are struggling, with homelessness. So how did you get to this issue? And could you tell us a little bit, about the paper?
Yeah, and I think as mentioned into the academia, I think, if I go a little bit back, I think as earlier I mentioned it that, like as, taking this kind of path towards like research and academia, I'm looking into like health from like, social determinants of land, like, kind of that focus. And especially like, with pandemics, like, the COVID-19 and infectious disease, we've seen like millions of people worldwide, um, get impacted. And also like, just looking at that and looking at the factors that kind of like contribute to that. And when we look at that, it's like housing,
Mm.
not just only like because I believe housing is, a basic need for everyone, but we've realized with COVID-19 pandemics, for example, when um, um, people were trying to adhere to, like, say, let's certain public health measures, right? So when we think about it, and just looking into those conditions and realize that, poor living conditions can lead to, like, health problems, and also make people vulnerable to infectious disease. And I think by that, and we realized that COVID-19 also, as I earlier mentioned, impacted millions of people, but impacted millions of people around the world. But we realized that certain demographics and certain people were impacted more than that. And among those, like, minorities and, refugees and people and, like, with vulnerable health conditions. And I think we're looking that we realized that the importance of race-based data. And I think in a way that, just collecting those race-based data would help us to understand and see where are the gaps that we can maybe help us to prepare for future pandemics, right? So this is like the idea of the paper came in to look into that. And I think, and with my team, Ashley Wilkinson, she's a PhD student at University of Northern British Columbia, and my supervisor, Dr. Rebecca Shea, which is a wonderful person, and I think someone that in the area of, like, housing and homelessness. She did a lot of work, so we're just part of, as a research team, looked into that and homelessness. And I think when you think of, as you say earlier to your point, just like places like Canada, maybe, like, those are the topics, but it's a wonderful place, I'd say. But also that doesn't mean that there's other, like, the issues that facing people. And I think these are the realities, and I think we need to touch on them and talk of them. So.
Certainly, I think people need to know the full picture. That in every environment, definitely you would have issues, issues of infrastructure, issues of health, like you mentioned, coming from Sudan as well, issues of security, right? That whether it's the so-called developed or global north or global south countries, countries are also disproportionately affected. Now, if I may ask you, why the Black community in particular? And I know it's not unique, to Canada. I also heard during COVID-19, places like the States, some European countries, like, it just exposed the level of inequality, right, in the health system. And when we look at the victims of COVID-19, we will see that a lot of racialized, minoritized people were affected more. Why, specifically in the case of Canada, would you say that the Black population is disproportionately affected by homelessness? What are some of the factors leading to that?
And I think that's very really good question. And I think and in taking a step on, like, enumerating, because even when you're looking at this study, look into, like, just look into the homelessness in Canada, and and that, systematic racism, and also, like, how that impacts really, like, I think when you look at it, just like systematic racism, right? Like, and this could be, like, key factor contributing to the overrepresentation of Blacks in unhoused population, I think. And that shows maybe it's rooted into, like, historical injustice as well. And I think, as someone who is not expert in history, but when we look at these issues, I think most of the systematic issues are historical. And I think, and there hasn't been, like, studies that, like, really looked into the issue and addressed them. And I think that's why when we look into the homelessness, I think when you look at certain reports, there were, like, high representation, overrepresentation of Black people and other minorities, and but we realize that there is a significant lack of homelessness enumeration, and when you look at that and saying, like, we see in certain areas, that in certain reports, that there's a big representation of, like, Black population, for example, but when we come into the literature, there's a gap in addressing those. So, like, those are kind of the first step that we took to look into the homelessness, so that we can address, to better understand the root causes of the issue.
Right. And what were some of the recommendations that you made?
I think one of the recommendations that we made is that into like, intersectionality, like to look into that, and I think for the need to like, for an international intersectional lens in understanding Black homelessness in Canada, I think can be beyond, because it studies like when you look at like, for example, homelessness, Black and Indigenous, but also like, look into like, for example, immigration status, like how that intertwine with being Black, and also like immigration and, where you live. And I think there's so many factors that intertwine with to affect the Black homelessness. So.
Mm-hmm. Yeah, thanks for that. Like I'm also very much interested in this area, and particularly from the perspective of international students. And recently I was doing a research just to see, in what ways international students struggle to integrate when they move to a country like Canada. And one of the issues certainly was housing, right? And here in Thunder Bay, it's even more so. I don't know about other areas that international students come, and there aren't a lot of, people will be shocked that there aren't a lot of accommodations available, for international students to rent, right? They come, of course, ready to go, but they are not able to secure accommodation. And in fact, even when they find a place, there are encumbrances of sometimes even police report. Sometimes you have to find a guarantor, and you're coming into a place, for the first time, you don't know anybody, right? And this kind of compound the issues for them. And one of the recommendations that I made, and I think that some other universities are doing it, is kind of arranging for a homestay program. A lot of families could actually open up their homes, and not just to high school students, which, a few people have told me they are doing with high school students from Europe. But I also believe that a lot of the international students could benefit. But it's not just the international student that could benefit from this. The locals would also benefit from these intercultural exchanges. So definitely housing is a big issue. Canada is a hot spot. It's a destination spot for so many people, and it has a lot of land mass. And I think that the government of Ontario, I think they have a new policy on housing. I don't know to what extent they are going to follow through on that, but I feel probably it's an area, of interest for the government. And thank you for writing this paper. I'm sure that it's going to go a long way. I do believe you're also finalizing your master's thesis, right? What is the big dream afterward?
Afterward, oh yeah. Speaking on the topic of the thesis, I think the thesis also touch into the housing and health, and I think, as you earlier mentioned, that this is like a big topic, and it looks into the housing and health of asylum seekers and refugees, and I think we know that the numbers of refugees and asylum seekers, like worldwide, globally, like it started increasing over these years, and I think according to UN reports, I think it's currently estimates almost 6 million refugees and asylum seekers globally, and I think this marks the highest record, I think, in the past years. And as we know, that Canada is like one of those countries that in resettling and receiving refugees. So, and I think one of the housing is one of the issues, because upon arrival, like asylum seekers and refugees into like new country, for example, Canada, they face like many numerous challenges, and I think one of them is like housing insecurity and inadequate access to healthcare system. So I think it's just touched back, and yeah, looking back to, I think your question, it'll be like the PhD. I'm thinking of a PhD, so that I will continue this journey of academia. And I know that you were, as a professor, I think maybe you would have a little input to give me on that. I don't know if if that's something that you would advise me or not. I don't know.
Well, if you've already got it in mind that is what you want to do, then definitely it seems that you know where you are headed, and you understand your own dream, and and what you want to do going forward. Certainly from my interactions with you, I do believe that, you know, you're on the right path, regardless if you choose to go on this academic journey or you decide to work, you know, with an organization. Because the good thing with what you are doing is that you could actually be an academic and at the same time be a practitioner, right? A health practitioner, a development practitioner, and then you bring those insights into the classroom. And I'm just assuming here that by being an academic, you're also thinking of being a professor. Am I right?
Yeah, that's right. So like first, I think as an academic, I want to be a researcher. I wanted to become a researcher, and first you focus on probably infectious diseases, and I think because as I earlier mentioned, that it affects millions of people worldwide, and this disease can spread quickly, right? And causing illnesses and sometimes like even death in case of like certain diseases like COVID-19. So I believe that I think going into that area and studying this disease can maybe help find way to prevent or like treat certain population. And I think research can make big difference in in the lives of people, but also like in policy wise, how we can develop maybe like certain public health measures and guidance when it comes to COVID. And again, earlier, like as you said, looking into the race-based data, I think it's like that when we have that's like race-based data and like the housings, for example, like this like which is wonderful research that done by my colleagues and my professor, Dr. Rebecca Chef. I think like when we have those kind of like we understand those factors, maybe it helps us to kind of like tailor even like during pandemics, like public health measures, like such as isolation. When we going into like, for example, looking into like how we can tailor public health measures and guidance that would be feasible, but also like would it's for all people so that they can adhere to it, right? So it's like when we're looking into like house isolation, we know that like would be everyone be able to isolate? Like would everyone be able to afford to that? Kind of those things, and I think that's where secondly like housing, and I think by also researching into the housing and I think finding solution to provide better living conditions, but also like eliminate homelessness. And I think, we're, as you earlier mentioned, it's like countries like Canada, I think, we could afford to, help provide everyone, equitable and livable housing. And I think, and lastly, probably the topic that also like kind of, it's my passion, I would say, working on refugee health. And that's, as I said, from earlier experience and also that's intertwined with like looking into the infectious disease and housing as well, because it's like they face challenges in accessing healthcare system, but also like know that like the living conditions. For example, if we look at it here in Canada, we don't have like refugee camps, but if you look at places like Jordan, Kenya, or like with the crisis in Sudan right now, like there's millions of people fled and displaced internally, but also like thousands that across borders to the neighboring countries. So it's like, I think just recession that's finding way to improve the healthy and the living condition of those vulnerable population. And I think, and also ensuring they receive the care and support they need, I think in such a difficult time like war. And I think that's my goal as a researcher, is to make a positive impact on, I think, health and well-being of those people facing housing insecurities or like facing like infectious disease and housing issues and challenges of being a refugee or newcomer. So that's the reason, like I think, inspiration behind the idea of research and academia as well. And I think also I love to talk to people. So that's one of the things that I think I would maybe enjoy being a professor in academia. But also as I'm interning at the Center for Respiratory Infectious Disease, so also like I'm trying to kind of practice and try to bring like bringing the real world experience well into the academia as well. I think kind of like hybrid both. So yeah.
Wow, that sounds like certainly a noble cause. and there will certainly be a need for your area going forward. The world is spinning out of control in so many quarters right now, and Canada definitely is still that place of refuge. And we wish you the best in your PhD journey. One last question, though, given that you are a health expert, I think it will be a fallacy if I didn't ask you, what is next? You know, how should we prepare ourselves for the next big thing in terms of infectious diseases? And I'm not saying here the next that COVID is behind us, but in a way we have adjusted to it. Should we be worried or concerned about anything else? As the last question.
I think that's a heavy question as the last question, I would say, but allow me to see if I could. I think as earlier I said, you mentioned that one of the conferences that I attended a few weeks ago, and I think it was about social determinants of health. And I think one of the speakers, Joanne Lu, and she was a former head of MSF, Doctors Without Borders mission. And in her speech, actually, like she said something that really resonated with me. She said that for COVID-19, the world wasn't ready, neither Canada. So like we weren't ready for COVID-19. And I think one of the things that like the gaps that we learned, I think those are the social determinants of health and the intersectionality of those factors that, you know, affected how people like went through COVID. And I think in order to how we prepare, I think, you know, working together, like either in academia, you know, like what you bring from your department, let's say, like, you know, you were in, for example, conflict resolution, you know, how we could, you know, work together to maybe eliminate conflict so that, you know, there's no new huge influx of refugees, you know, and then we don't have like huge spread of like, you know, like certain communicable disease, and also, but also like working together to address homelessness, for example, so that, you know, we are prepared for pandemic. I think it's preparing is just like prepare us, like, you know, working together from like interdisciplinary like viewpoints, and I think that would be helpful so that we could collectively address those gaps.
Right. So you push the responsibility back to the conflict and peace practitioners and academics like us. But I like what you said about all hands have to be on deck to make sure that you do your own part of the job. And if you focus on preventing conflict in the first place, then we are not going to have the escalation of the housing problem too, right? And so on, which is also interrelated with the spread of diseases. Thank you very much, Khater. It's always a joy chatting with you. And like I said, we wish you everything of the best, completing your master's and moving on to do a PhD and becoming a professor. I can't wait to be in your classroom. So enjoy the rest of your day and hope to have you back again soon. Bye-bye.
Thank you very much. Thank you for having me. Thank you.